morning and welcome. In partnership with the Build Initiative, Prenatal-to-Three Capacity Building Hub, the Louisiana Policy Institute for Children is hosting the Louisiana Home Visiting Capacity Report release. My name is Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children. LPIC is a nonpartisan independent source of data, research, and information for policymakers and stakeholders on issues related to early care and education for our young children ages birth to 4. The purpose of the Home Visiting Capacity Study Report is to document some of the history of voluntary home visiting in Louisiana, summarize current home visiting efforts, and provide information on key elements in moving forward to a future in which we hope that all families who want access to home-based family support and coaching can do so. Voluntary home visiting for pregnant and parenting families with young children is a proven, evidence-driven strategy that enhances family and child well-being, supports improved maternal and child health outcomes, and helps families connect to important community services. We have a full agenda. However, we will allow time for Q&A at the end. Please type your questions in the chat, and we will address them at the end of the presentation. At this time, it's my pleasure to introduce Dr. Jeff Nagel, founder of Alliance Strategic Advising and Research and an adjunct associate professor of psychiatry at Tulane University.
Thank you, Dr. Saunier. Happy to be here with all of you today, as it's been my pleasure to work on the study. Louisiana has a rich history of offering voluntary home visiting to support parents, going back over 20 years, and leverages federal funding for this work. The Louisiana Department of Health deserves a lot of credit for investing in this program, for being ahead of the curve, supporting young children and families even before the current federal support was available. I'd like to start by reminding all of us of why we need to be focusing on voluntary home visiting and what an asset it is for Louisiana's families with young children. Voluntary home visiting programs are some of the most well-studied and proven supports to pregnant and parenting families. Longitudinal research has shown that many benefits of connecting young parents with trained professionals who support and strengthen the parent-child relationship by offering guidance on child development, parenting, and accessing community resources. These programs typically involve regular visits from a home visitor over a period of several months or years. Research confirms that voluntary home visiting programs can bolster positive parenting, improve maternal and child health, and promote child development, leading to improved outcomes for both children and their families, including increased school readiness and the prevention of child abuse and neglect. Additional research has shown that home visiting programs can lead to cost savings for the government through reduced need for social services and public assistance and increased employment earnings among those families participating. The primary program in the state, which is the Louisiana Maternal, Infant, and Early Childhood Home Visiting Program, known as MCV, has demonstrated important success with regard to capacity and retention, length of enrollment, representative family demographics, and family satisfaction. The Louisiana MCV program includes 2 of the nationally recognized evidence-based voluntary home visiting models: the Nurse-Family Partnership, known as NFP, and Parents as Teachers, or PAT. Families are matched with registered nurses in the case of NFP, or parent educators in PAT, who provide personalized education, guidance, and support to meet each family's individual needs and empower them to reach their goals. Eligibility criteria and the parishes served are detailed in the report. Yet, based on current capacity, only 6.1% of the families in the state are able to participate in these services. And even if we restrict the analysis to just those families whose health insurance is provided through Medicaid, it is still less than 10%. Even maintaining the current service levels is in doubt, as one-time federal money has been helping support the program. Given the strong benefits of Louisiana MCV, both from years of high-quality research and from Louisiana-specific qualitative research, the course of action that best advances the needs of young children and their families is to grow this work. Recent qualitative research showed that community members believe there are many families that are unserved who could benefit from home visiting services. This research also found that community partners feel that the home visiting services are a valuable support to families. This finding is supported by feedback from the families who are being served in the program, who report positive experiences from their participation. Perhaps most importantly, the qualitative research showed that community members felt that the eligibility criteria for NFP, which is specific to first-time parents beginning before the 29th week of pregnancy and being low income, were a barrier to providing support to many families who could benefit. The Bureau of Family Health has been responsive to addressing this issue by implementing PAT, which has broader eligibility criteria. To respond to the qualitative research and the positive feedback from the work already underway in Louisiana, this report provides information about the implementation of an additional voluntary model that is less intensive than the current models being implemented. This model would provide 1 to 3 home visits between 2 and 12 weeks after birth of the child at an approximate cost of $1,300 to $1,500 per family. And this program is currently being scaled elsewhere in the country, details of which are provided in the report. Implementing this model to all who would choose to participate would require approximately a tripling of investment in home visiting in Louisiana and a commitment to ensure enough qualified staff and infrastructure are in place and available to do the work. But it would allow Louisiana's families to more fully reap the positive benefits of home visiting programs. This change is certainly within reach. So now at this time, it is my pleasure to introduce Amy Zapata, the Director of the Bureau of Family Health within the Louisiana Department of Health. Amy?
Thank you so much. Thank you, Dr. Nagel, for the introduction and for your work on this report, and Dr. Sonia for helping to make that possible. I am really proud to be part of a program that represents one of the great innovations in the state that's been supporting the health of families and families with young children. These services really at their essence are about helping families to do what we already know that they want to do, to have the healthiest pregnancy possible and to help their children thrive. We have, Louisiana has 24 years of growing a successful service system that's able to implement complex services with fidelity and achieve outcomes. And before there was federal funding, as Dr. Nagel said, we've been working to help states make evidence-based family support and coaching widely available. Before there was federal funding available, Louisiana's policy leaders, advocates, and legislators knew that home visiting was a worthy investment. And now, as a result of that, there's statewide reach. But we also know that there are more families who we're not reaching. And some families may want a support that's for a shorter period of time or less intensive than some of the services that we have available now. The great news is that there are more proven models than there were even 10 years ago, and some of them are being piloted in the state. And so right now, between the Go Far initiative and the last week's release of Whole Health Louisiana, a multi-sector effort to integrate trauma-informed and healing-centered approaches in our state's systems of care and support for children and families, now is the time for Louisiana to innovate again. And I'm so pleased to be able to use this report as we look to the future. At this time, I really would like to introduce somebody who really knows these services the best, and that is Marilyn Fontenot, who is an assistant supervisor and talented nurse home visitor for the Louisiana Maternal, Infant, and Early Childhood Home Visiting Program.
You're on mute, Marilyn.
Hey, Marilyn, you're on mute.
I'm sorry. I'm sorry. Thanks, Amy, for
You're
the
great.
introduction. And thank you all for the opportunity to speak today. So the home-based family support and coaching allows for one-on-one attention in the home to ensure that parents receive individualized care and guidance and information tailored to their specific needs. We are available to families who live in rural communities and who have circumstances that would not otherwise allow them to have access to services. So Helping these parents see their potential and focus on opportunities and solutions is part of our program. And with the home visitor being there for their support, when parents know their own strengths, it builds their confidence and supports positive interactions with their children. And it also, we encourage clients to advocate for themselves and for their babies. Specifically, we provide strategies and support for effective communication when interviewing for jobs, when speaking with their employers or guidance counselors at the school. And many times we provide information on how to speak with the physician so that they can get the appropriate care for their children as well, or for themselves. So they're able to gain access to the opportunities and resources needed for the family to thrive. Through the assessments that we provide in the home, many times we're able to identify early signs of developmental delays and health concerns that the client may not even be aware is a concern. Speaking with the clients and other colleagues during telephone surveys, I do the telephone surveys for our colleagues, and a lot of the things I hear from these clients, they feel that the relationship with their nurse is very positive. They feel that she listens and that she provides information in a way that they can understand instead of all the medical technology or terminology that they may receive when they go to the physician's office. And a unique opportunity for us to provide comprehensive child and family services in the home is because we meet them in their own environment. This allows us to understand the clients and how they need learn best. And sometimes their environment is part of the issue because the homes are sometimes crowded and we may have to, find other places to meet with our clients. Through home visiting, we're able to support the whole family by providing access to resources and building skills for parents and their children at the same time. So,
You're back on mute.
You hit your mute button again, Marilyn.
sorry. So, like I said, going in the client's home allows them the ability to feel more comfortable, and they tend to open up and share things with us that they may not share with their provider. So those are some of the key benefits of home visiting.
Thank you so much, Marilyn, especially, having over 21 years of experience being a provider. Your voice definitely lends the voice that we need as we're talking about home visiting programs in the state of Louisiana. At this time, we can begin our question and answer portion of the agenda, and happy to take any questions that you can place in the chat. I received one privately real quick, and we'll go to that one. The question is, what approaches do programs use to identify, reach, and recruit families? And what types of community organizations refer families to home visiting?
Good morning, Libby. This is Susanna Boudreau. I'm the program manager for the Maternal Infant Early Childhood Home Visiting Program, and I'll be happy to take that question. As far as approaches that our programs use to identify, reach, and recruit families, human-to-human connection is our preferred approach. Making connections and establishing relationships with community organizations, referring partners, previous graduates of our home visiting services. Those are some of the key ways that we identify, reach, and recruit families. As far as types of community organizations that refer to home visiting, varies widely from crisis pregnancy centers to our OB offices, sometimes our MCOs, pediatrician offices, even some local school systems, high schools, early head starts. And our biggest referring partner currently is WIC, Women, Infant, Children.
That's great. A quick follow-up question. How do programs communicate and work with the referral partners?
We have the McVie referrals at la.gov email address. That's an easy one-stop shop for anybody who is interested in making referrals. But again, I'm going to go back to that human-to-human, face-to-face connection is really our primary method of communicating and following up with referring partners. Each one of our teams spaced throughout the entire state have relationships with community partners and referring organizations in their towns and in their communities. And a lot of times they're stopping in and having conversations with OB offices, with front desk clerks, with other community organizations that serve and offer supports to families, maintaining that relationship and making sure that they're aware that not only are referrals welcome, but when we are able to, we also follow up and let them know that previously received referrals have enrolled in the program.
Thanks so much. I mean, at the heart of this is just what you said, is relationships that we have to get to make sure that we're maintaining and they're reciprocal in nature. A couple of questions that just came in the chat is, will the state be releasing an RFP to include funding for evidence-based home visiting programs that are being provided by other NGOs?
I think I can take that. This is Amy Zapata. I would say that is a question for the future. I think that the landscape for home visiting has really changed a lot. There are a lot of different models, and there are also a lot of different types of providers and systems that are interested in doing it. So there are some models that are best for integration within healthcare delivery systems. And then there are some that are more community-based. So my hope is that this report will help us to have a larger coalition, a larger discussion of people saying what is right for the future for the state. Certainly RFPs could come out of that. We don't have one planned at the moment, but this report really is some of the foundational work to rally all of us to say what do we want for our state and what are the right models and at what scale.
I think there's a real kudos there, Amy, of, you all are being really responsive to community and what they need to be able to decide, as a collective decide about how the state should move forward. And so that's what I hear in that, and that's incredible. Another question by Fairshea Perkins. Can you say more about the different home visiting models of peer-to-peer versus professionals, NFP, et cetera? Do different approaches meet different family needs?
This is Susanna. I'll be happy to take that question. So for our nurse family partnership model, of course, the emphasis there is on first-time mothers, as previously mentioned, and certainly around the health and outcomes of first-time pregnant individuals and the health of their baby. Although once baby is born, continuing to monitor growth and development and the checking of those developmental milestones. For the Parents as Teachers program, that particular model employs a variety of professionals, multidiscipline. And while it says parents as teachers, we do have a variety of professionals who staff that program with the emphasis of growing the strength of the parent as their child's first teacher. And so while health isn't an overtly strong emphasis of that particular model, it certainly is addressed. And developmental screenings, developmental growth milestones are certainly monitored and supported along the way. And the overarching goal there is making sure that the child is ready for kindergarten, teaching the family and the parents about strength-based approaches.
Thanks so much, Susanna.
If I can pipe in on that one too, in as much as all of these models are about supporting families to do the best that they can do to support their children's development and that early relationship. Ultimately, the early relationship is the foundation of health.
Absolutely. And I would also like just a quick call out, because Susanna and Amy, you all at LDH have worked so closely with the Department of Education related to developmental screening. So that could be something that is really an integrated system throughout our state. And so I know that's been a lot of hard work, and just want to shout out that hard work in this space now. Andrew Gallo asked a question, would expanding home visiting in the state essentially be a matter of increasing state budget for the programs, or what other sort of steps might it take to expand these programs?
I have a couple of thoughts about that, but Dr. Sonia, I don't know if you want to pipe in on that as well.
Sure, I'll let you kick it off and then I'll riff off of you. How about that?
Okay, that sounds good. I think to reiterate what I was saying before, for me, I think the biggest thing first is setting a direction and a vision for what do we want to see in Louisiana, and then how do we make that happen. And certainly resources, financial resources to support that are needed to do that. I think that's outlined in the report with what Dr. Nagel was saying that would have been the budget needed for one of those potential models. So I think it is deciding what are the models that we really would like to see at what scale in the state, and what does it take to finance that, and what does it take to finance for successful implementation of them. Each of these has different requirements for staffing ratios, or for curricula, or for training, and for oversight to make sure that they are being implemented with fidelity. And so I think it's in part vision, I think it's part direction, in part finance, and in part making sure that there is whatever the infrastructure that's needed to be able to implement those models with fidelity.
Thanks, Amy. I think the other piece too, to Amy's point and to the question, is I think it's really what are the approaches that best meet the needs of in our state, and not saying it's a one size fit all. That's very clear the direction that LDH is taking to be responsive to the needs of our state. And then the other piece is an opportunity to look at some pilot programs that are going on in the state. We have a pilot program through the New Orleans Health Department that they're piloting the Family Connects program at Baptist and at Touro in New Orleans, which is a universally offered home visiting program, and trying to get to a place that we could have, in fact, a universally offered home visiting system that's not just one program versus another, to really meet the needs of the family. So increased investment is always going to be a need, but also if you think about smart policy choices that are both internal to the agency and external, if we, of making things into statute that may make it better and easier to have universally offered home visiting programs. But I would say this study is the first study in a long line of things that we really we want to understand more deeply in our state to meet the needs of our families. I know Dr. Nagel had something he wanted to pipe in as well, related to an earlier.
Just going back to that question about, are there different models to serve different families? I think that's an important question, because there's different approaches to these voluntary programs for families. Do you make it universal, or do you target a certain group that has been identified, with whatever need that program would address? So of the models that have been kind of deemed evidence-based by the federal government, and those are all listed in the report, some of them do have very specific targeted audiences that they're trying to serve. Sometimes families in really great need, sometimes after some sort of abuse or neglect or substance abuse specifically has caused that family to become clear in the eyes of the government. So the current approaches by Louisiana are more universal programs, even though NFP is kind of universal for a very targeted group, meaning first-time parents. And that has always been a conflict, because obviously there's many parents who could use support who aren't just first-time parents. So that is why, the Bureau of Family Health responded to that need and brought in Parent as Teachers, one of, those evidence-based programs. So I think what we've done in this report is talk about another option. Dr. Sonia just mentioned Family Connects, which is being piloted in New Orleans area. That is a model that several states are looking into, because it is a very universal, a much lighter touch, where it's 1 to 3 visits shortly after the birth of the child. So it's less intensive, less costly, and can provide support to many, many more families, which is always difficult, because most of these evidence-based models are very intensive over a long duration with, highly qualified professionals. So you have workforce challenges, you have budget challenges, and yet now there really is an option that is a much lighter touch, so you can reach many more families, because as the report, points out, it's only, the current capacity of home visiting is only reaching, under 10%, under 6%, how you're looking at it, of families who are having children. So a long-winded answer to your question, yes, there are different models to achieve different goals. And really the first way you start to analyze it is, are you looking for something targeted or more universal? And that's broken out in the report.
And we know that all families have needs in this time of life as they're having young children and going through postpartum. And so that universal approach that is being looked at, I think we all agree is important. Did have another question that came in. Other states and in fact, other countries have different models of home visiting. Will having this help Louisiana reduce maternal and infant mortality rates, which continue to be so high?
Putting myself off mute. So that certainly is the aim. We have other work that's occurring to expand the availability of doula services with the new doula registry. And while that is not considered one of the maternal, infant, early childhood home visiting recognized models currently, but that is a service and a workforce and a support that we are working to expand in the state alongside evidence-based home visiting. I think it comes down again, not to push us too far down the road, but I do think it is part of the vision of what are the types of supports we want, what are the types of outcomes that are important for us to address, and maternal outcomes or the child outcomes. Each one of the models has a slightly different focus for the outcome of that it's trying to really address. All are working to improve maternal and child health outcomes generally in one way or another. But I think it's a matter of which particular outcome are we wanting to prioritize in the future, and are these models best suited to assist. I think another really important element of planning and visioning for the future is not only what do we need and what models are available, is then the feasibility of those workforce. Who is the workforce that implements that model, and do we have sufficient to scale up a particular model? Are there enough nurses, or are there enough social workers? It really depends on what's the what model. Each one has different criteria for who is that trusted coach and that trusted support providing the service.
Thanks so much, Amy. A follow-up question from Andrea was to follow up on my remarks about this studying really being the first step. Asking what are our next steps, and what should we expect to see on this topic moving forward? I think next steps are really studying, and an evaluation is underway currently with the Family Connects program happening in New Orleans, related to its effectiveness and how to move forward with a policy potentially that would couple work with not just the New Orleans Health Department, but at the state level as well, because we all rely on each other. And I think next steps moving forward too are having conversations with many legislators that are asking for more support for families, and being in dialogue with them as well as in our community. Because oftentimes what happens to families, and it happens to providers too, is that things are done to them instead of with them. And what I really hear from our friends at the Department of Health, and what we're learning from this study, is that community wants a voice, and our state agency wants community and providers to have a voice in a system that we know that we want to grow, but we want to do that in a thoughtful, meaningful way, using data and community voice in that process. And I think I have just a couple more things in the queue that I saw. What accomplishments and challenges do programs experience in maintaining their caseloads?
This is Susanna. I'll be happy to take that. As far as accomplishments in maintaining caseloads, I would say that when we are able to enroll the family at the earliest opportunity and maintain a connection and service to them up until the time of program graduation, that is the single greatest accomplishment. The amount of growth that takes place through not only the child, but for the family as a whole is life-changing and has a significant ripple effect. Challenges, think about how busy all of your lives are, and then imagine if you had several little people. Families have a lot going on, and so sometimes maintaining connections in keeping home visiting appointments and or just being available and navigating all of the challenges that come along with having young children. We have been able to really support a lot of our families. One of the benefits coming out of COVID was that we realized that telehealth does have some good uses, and we have been able to implement a hybrid approach to our visits for our families. So certainly we love in person, but we are able to offer some flexibility around that. And that has gone a long way toward addressing one of the biggest challenges, is just maintaining engagement when you're trying to juggle all of the other things in life.
Absolutely. As a former home visitor, yes to all the things of the challenges. And then the last question that I'm seeing is, what opportunities exist to increase the number of identified families, and how can programs work with referral partners to increase referrals and enrollment rates for successful enrollment?
I'll happily field that one again and go back to something I said at the very beginning, and it's all about relationships. When I worked previously with the special school district, I had never heard about McV until I came over to work with the Bureau of Family Health. And I think that continues to be a pervasive challenge for us. We have a fantastic program, and not too many folks know about it. I was on a webinar earlier this week talking about rural health and home visiting, and the same challenges were brought up in several places across the state. Fantastic program, not enough people know about it, including referring partners as well as families, that this opportunity exists. Currently, we are about at 80% capacity, and so in real terms, we could serve another 300 families tomorrow. We just need to continue to solidify those relationships and increase the awareness of this wonderful opportunity.
Absolutely. Thanks so much. Thank you to everyone for joining us today, and thank you for your thoughtful questions. I hope we all walk away with a better understanding of the history of home visiting and the impact that home visiting capacity has on families and young children in our state. I'd like to also thank the Build Initiative Prenatal-to-Three Capacity Building Hub for partnering with us to make this webinar happen, and our Policy Institute team, who have worked tirelessly behind the scenes to make this look easy. And a special thank you to our partners and friends at LDH and Dr. Jeff Nagel. We wouldn't have been able to do this without any of you. To learn more about early care and education and home visiting, please visit our website at policyinstitutela.org. And to learn more about the Build Initiative Prenatal-to-Three Capacity Building Hub, please visit buildinitiative.org. Again, thank you, and thank you to many of our partners that are on the line today, in particular to Jeannie Donovan from the New Orleans Department of Health, as well as our partner Susan Nelson from the Louisiana Partnership for Children and Families. Without these partnerships, we can't do this work, and so we really appreciate them and all of you who are here today. And make sure you follow us on social media, and if you have any questions, please follow up.